Hi everyone! Thank you for watching my immunology presentation. Today I'm going to be talking about lupus erythematosus. So, in this presentation, I'm going to be covering the history and prevalence, pathogenesis, symptoms, diagnosis, prognosis, and treatment options for the disease. So the name lupus was coined in the 13th century, and it comes from the Latin word for wolf, because rashes that are common to the disease actually look a lot like a bite mark, and at the time people thought that that might have been the cause or that there was some relation, and the name has stuck around to today. So there are 4 different types of lupus. They are systemic, cutaneous, drug-induced, and neonatal. The first is the most common form, and it affects multiple organs in the body, while cutaneous affects only the skin. Drug-induced has no genetic factors involved, and neonatal is the most rare and is caused by a reaction in the child to the antibodies from its mother. For now, though, I'll be focusing on systemic lupus erythematosus, or SLE for short. So SLE is a disorder that occurs when a person's immune system attacks itself. Because of the pathology of the disease, SLE can affect nearly every system of the body, making it highly variable and very difficult to diagnose. The disease is characterized by cycles of exacerbation and remission, and the onset of symptoms begins in the mid to late teens and occurs more often in women than in men, almost so that 90% of the cases are in females. So the true cause of SLE is unknown. However, it comes down to the key aspects in the relationships between genetic factors and environmental. First, a person must be genetically predisposed to having SLE. However, not all people who are predisposed will present with symptoms. Scientists have narrowed it down to 10 specific markers that they think may be the cause. However, a lot is still unknown about the disease. As far as the inheritance pattern goes, it is most commonly autosomal recessive, but not enough so that we can say that as a fact. As for the environmental factors, they act as triggers in people who are predisposed genetically. So such things like ultraviolet light, smoking, drugs, infections, chemicals, or hormone changes can be seen as something that will cause the disease to enact. As far as hormonal changes go, estrogen is the predominant one, which is why females are much more likely to have lupus than men. So the pathogenesis behind the disease is that SLE is exacerbated when a person who is genetically predisposed is exposed to one of those environmental factors. For an example, someone who may have the underlying genetics for it are exposed to sunlight for too long. DNA damage from the sun exposure will undergo programmed cell death or apoptosis. And after death, the internal proteins of those cells is displayed on their outer membrane. Typically, in a normal immune response, the body will clear those cells away with macrophages or something like that. However, with SLE, these dead cells are not cleared effectively, and that is the issue. So this is due to a deficiency in the complement proteins, most commonly in C1. Because these apoptotic bodies are not cleared and these cells remain in your system, you are continually being exposed to them, and this prolonged exposure causes sensitization, specifically a type 3 hypersensitivity reaction. And once your body is sensitized to the cells, they are seen as antigens and are picked up by other components of the immune system. So these antigens are activated then by they activate T cells and then presented to naive T helper cells, which promotes a humoral immune response. So these antibodies then that are activated and released further activate the complement system and cytokine release. And overall, inflammation increases a lot, which damages tissues in the surrounding area. So this occurs in a cascade, which continues, causing more and more damage until the inflammation finally settles. However, like I said before, a hallmark of this disease are the cycles, and the minute another trigger comes and a person is affected again, it'll just continue over and over again, continuously causing more and more cell death. So as far as symptoms go, because of the capability of the dead cells to be anywhere in the body that is exposed to the trigger, The symptoms vary very greatly. However, there are a few that are more prevalent than others, and these are arthralgia, arthritis, fatigue, and rashes. The most rare of these symptoms are ulcers in the mouth and nose and Raynaud's. The latter being a lack of circulation to the extremities, which is most likely caused in this case by the increased amounts of inflammation. So here I have some of the images of the rashes that lupus patients have. So on the right you can see the malar rash, and that is across the bridge of the nose and the forehead, creating a shape that gives it the name the butterfly rash because it looks like wings of a butterfly. And then on the far left is a picture of the discoid rash, and those are more round scalar patches that have plaque-like textures. And those two symptoms alone are what are present in cutaneous lupus that I mentioned before. However, in systemic, it can affect all the other parts of the body as well, like I said, so the middle picture points out a few of the symptoms that it can cause there, and I'll cover these later. So, diagnosis. Because of the variability of the disease, there must be at least 4 of the following 11 criteria met before we can confidently say that someone has lupus. And these are, first and foremost, the malar rash, which I just showed you, as well as the skin rash. Photosensitivity to light, so that UV radiation is one of the main triggers as far as lupus patients go. So photosensitivity, mucosa, ulcers in the mouth or nose, non-erosive arthritis, so inflammation in 2 or more joints, cardiopulmonary inflammation. Neurological symptoms are one of the more egregious symptoms that could happen here, and that could be seizures or psychosis. Kidneys could be affected, so renal disorders. Blood is one of the others, and immunological disorder. So I believe number 10 is kind of a given with all of these because your autoimmune response is what is causing the progression of these symptoms anyway. And then finally, anti-nuclear antibodies, and those can occur in various different ways as well. So if a person has, like I said, 4 or more of these, then we can successfully diagnose them. Patients who are then diagnosed have typically relatively normal lives. The symptoms are more irritating and uncomfortable than they are lethal, and luckily they are also non-contagious. So people with lupus focus on mitigating its effects more than not. Unfortunately, there is no cure currently, but life expectancy doesn't change much unless you have one of those symptoms that is more dangerous, such as maybe the seizures or it's occurring in a vital organ. So treatment options vary a lot based on the doctor and the specific symptoms. So if you're treating based on, say, the discoid rashes, you might treat that with a topical cortisone treatment, whereas if you're treating a blood issue, then you might treat that with a blood drug specific to what you are experiencing. However, there are a few common treatments to generally treat the symptoms of lupus, and they aim to suppress the immune system. And these are typically NSAIDs, corticosteroids, and antimalarials. I've listed the 3 main ones that are used here as well: acetaminophen, prednisone, and hydroxychloroquine. And these are all options to help suppress the immune system as a whole. The latest treatment for SLE that I read about, which is actually quite interesting, is a drug that is aimed at targeting one specific immune cell. So typically I think it was B cells, so it would suppress B cells alone rather than just blanketing the entire immune response. Hopefully in the coming years more work will be done to help this and treat the symptoms of lupus and hopefully cure it altogether. I think that, like most diseases, if we truly find the cause, then it'll be easier to treat. But that concludes the rest of my presentation. I thank you all for listening, and I am very excited to discussing it in class and answering any questions you may have. Thank you.